guys have volunteered yourselves to assist, and you've been sidelined, and people think that you are coming to disturb them as they are busy, having their hands in the cookie jar. So I want you get ready to speak after Dr. Kanjo. Dr. Kanjo?
Yeah, thanks. Thanks. Yeah, I've unmuted.
Okay.
Yeah, a couple of few things that might talk to solutions, and we have mentioned.
Can you all mute except Dr. Kanjo?
Okay, thank you. There are a couple of few things, Ranyati, that probably will really help going forward. I'm going to start with the last ones that have been mentioned just now, the chiefs and the councillors, municipality officials. These are the people that they are influential people in their areas. They communicate, they've got communication structures that they have been established over a number of years, which basically then means that more information and more knowledge has to be imparted on them for them to proceed. Maybe one must understand that we had level 5 in South Africa. We started straight in level 5. We never started from level 1 and moved and worked our way up to level 5. We worked it other way around, and the whole world is actually commending us for having done that for good reasons. That has left the chiefs and the councillors, particularly the chiefs, emasculated, if I were to put it that way. All their power and all their structures were sort of muzzled, and it was a top-down approach from the government and the authorities that made them made them do their work. So maybe one needs to understand this from there.
Dr. Kanjo? Dr. Kanjo? Dr. Kanjo?
Yes, yes.
There seems to be a lot of echoing.
On my side.
There's a serious echo. Can you guys, I hope there's no one who's got this thing live on their phones, because it creates an echo.
Yeah, I know my phone is on mute, so I can switch it off.
Okay.
Oh, so there's one area of solution that can come when it comes to dealing with empowering those chiefs and councillors. In addition to that, almost every community has some influential people amongst themselves. The general practitioners and nurses, teachers, and everybody else in the community can really do a lot of good work to make it work in terms of how best to intervene with coronavirus at a social level. The training of healthcare workers, thanks to the also having mentioning that the community workers, which are in large numbers in our province and many other provinces, need to be more and more recruited and trained and be out in the field. Okay. Lastly, Dr. Fundile, am I still audible?
You are audible, but the echo is still there.
From my side.
It's not clear where it's coming from, but just finish up, Dr. Kanjo, and then we may have to wrap up the discussion.
Yeah, just to finish up on the hotspots, the hotspots have been identified, and Eastern Cape has its own hotspots, which are where these fires can move from one place to the other, not giving a warning on everybody. So every time there is a hotspot where it flares up, it must be attended to with all the necessary support in terms of the more PPE and more of the testing and tracing and quarantine. And let us open up those quarantine places and let people be treated for the period of time. I think that is, I can stop in there, Fondile. Thanks.
I think we are experiencing some echo, so it's going to affect our discussions. All right. I will ask that each one of the colleagues to just give their closing remarks.
All right, gentlemen, let me quickly get to the bottom of it and try and give my 2 cents worth of advice as to what we can do going forward. I think the down-up approach is what we need to adopt, because the up-down approach is what is really not working at the moment. You will hear that provinces are working on the basis of the information that is filtering from national. And there's no way that national government can know what is going on in the various districts. We need the down-up kind of an approach. We need to get the right people employed for the right jobs in our province. And we have already spoken about at length about who is where and doing what, and what background have they or have they not got. We need to get the people that are making decisions to take feelers from the people that are on the coal phase, so that they can be able to plan their way going forward. The big mistake that the people in government are making is to think that they can manage the patient. No, they need to be able to manage doctors and make sure that doctors' lives are looked after, so that doctors can look after their patients. Now, they are making it the other way around. They want to run and manage hospitals whilst they are sitting up in their offices. If we can be given our role as doctors to manage patients, and they would do their HR related work, that should work well. People that are decision makers need to seek the right information from the people, again, on the coal phase. They need to act decisively on the relevant information. We have already spoken about the need to educate our people. Otherwise, if we keep asking, what is the role of civil society? What is the role of churches? Those people will not have anything to say, including the role of chiefs. They will have nothing to say if we keep quiet and we don't teach them the right and the relevant information. Monwai, now to the Tabelela, you touched on masks that are supposed to be freely available, just like condoms are.
All right, Dr. Moy, Dr. Moy, Dr. Moy.
Hi. Yes, Dr. Nyati.
Yeah, I think the echo problem is still there. So we need to wrap up. So, Dr. Tebele, one word, one statement.
One statement from my side to wrap up is that this is an opportunity for the province, if not for the national government, to start implementing NHI. You cannot ignore GPs in everything that you are doing in the face of what is coming. GPs are a critical part or backbone of primary healthcare. We have copied the system in UK and we're inviting Cubans. Cubans are very good at primary healthcare, so you must focus on involvement of GPs. It's a pity GPs, they come in bits and pieces, but they've got a lot of notes to take and to sort themselves in terms of organizing themselves, so that we have a unified role to play as GPs. Fortunately, some of us are doing some of the private work and public work, but this is an opportunity for government to implement some of the NHI principles. GPs and public health, we can do better. The second point to close on, NHLS and the private labs, I see there's Discam coming in. NHLS is having a lot of backlogs. So there's involvement of Discam now. I don't know why government didn't negotiate a price with private labs directly. Maybe that's some other thing to think about. But there's a lot of stuff that is coming in because Discam is now going to take over some of the private cases to test private patients that cannot afford private labs. Thank you.
Dr. Jacobs, your last statement, we need to wrap up. You know, we have a poor echo, but just try, speak slowly and say something. We can't hear him. Can I, where's yours here? Let's do this. Let's see how it is. Network security. Yeah, network.
Unmute, Dr. Jacobs, please unmute.
You didn't hear me? Hello?
Yes, we can hear you.
Oh, I was saying, Doc, we need proper COVID wards and isolation facilities. We need a change of mindset in our hospital staff and cleaning personnel. And we need more PPE. And as Dr. Tebelele has said, we need more contractive of private labs to try and mitigate and fast track the testing for COVID-19. And then we need the setting up of the temporary hospitals to meet the need that is growing now for COVID admissions. Did you get that?
Okay, right. It's quite frustrating for me this side, but
we are hearing you quite well.
Okay. All right. Okay, that's fine. All right. Let's get Dr. Moi. Sorry. Let's get Mutakupuma to give his closing statement.
Okay. As I said before, the main thing, I think it's teamwork. Also, Dr. Tebelele has touched on it. This COVID is giving us a chance to prepare for NHI. In other words, if private and public can work together. Also, my number 2 point is also, I think there's always a saying that goes, if you think alone, you are always right. Now, the government is thinking alone on this thing, is not being a team player where it's involving other people or other health professionals in public and in private. So if, as Dr. Moi had said, that if they can lend an ear to the people who are right on the firing line, they can get an ear and understand what is going on, then I think the solution will be a lot simpler than actually just saying we're gonna do it this way and we're not gonna listen to other people. So I really think that if we can listen to each other, we can go a long way. Thanks.
Thank you. All right. So Dr. Moi, and then Gunman, you will wrap things up.
Forgot to unmic myself. And thank you, ladies and gentlemen. And I think we are on the right track now. If we can start putting our minds together, we will definitely get to some point. That will be my parting shot. Out of being frustrated with what is going on in our doorsteps, in our districts, in our province, I'm sure we should be able to get somewhere. Let's get the momentum going. Thank you.
Yeah, no, thanks, thanks, Fundle, for creating this platform, and I hope this platform gets expanded with regards to all the facets that we seem to be confronting in dealing with the COVID-19. All the areas that have been mentioned by my colleagues here speak to one thing and one thing only: this terrible flu, as it is known by our communities and our patients, has got a beginning and has got an end. The fact that it is going to be with us in some ways long after the pandemic, in the form of the mutations and the rest of that, is another matter that we can deal with at that point in time. For now, we have to prevent it. We have to deal with people who are infected by it. We have to find them, trace them, track them, and treat them. And the various platforms that have been put both by government and civil society and professionals, if they can all work together and communicate with each other and be patient, like you're dealing with your patients, and be patient in making sure that each and everyone gets the message very clearly, needs what to do when he or she does not have the virus at this point in time, and when he or she gets it tomorrow from the close persons to him or her, from the relative, one needs to know what is the next step to take when this and that happens. Look well after your professionals, because if you call them the foot soldiers, then you must give them the shields and the bulletproofs to fight that war. If you don't, the very first people on the forefront will be the ones who fall, and everyone behind them will fall. I think it's good, the platform that you've created, Dr. Nyati, and I really appreciate, and if I were to speak on behalf of my colleagues, it is a good platform to have. And all of you guys are influential people in your fields. Make use of that opportunity and work together with other influential people in your communities. Like I mentioned, those chiefs and those counselors and those teachers and those nurses in that community are some of people who can communicate your message once they know it. I think with that, I really thank you for the opportunity. Thanks, Dr. Fondi.
Okay. Yeah. I think Dr. Jacobs, being the only female in the panel, I'll just give you another chance to say something, because you are the only lady. Please give us our closing thing.
Our closing. Our closing statement. Can you hear me, Dr. Nyati?
I can hear you.
Oh, okay. As we are about to open schools, it would be great for the Department of Health to have a sort of like communication or a communication line with Department of Education in terms of training teachers, or having Onomakaya that will be assisting schools together with our Landuka EHPs and maybe clinical associates, so that they can try and beef up and help with that side, because that's another issue that's going to be cropping up now.
Is that all?
Yeah, that's all.
Thank you very much. Colleagues, Thank you very much. I know the last part of our interview, there was a lot of interference, but you know what, 80–90% of the interview went very well. So I want to thank all of you. It's not the last time I'm coming back to you to ask you to be part of this kind of discussions, but at least today we have started something, and we will make follow-up discussions in the weeks to come.
Thank you, Doc.
All right.
Thanks for affording us the opportunity.
Okay. Thank you very
if
much,
someone
Dr.
cares,
Pupuma.
even if
You wanted to
Papa-
say something? Dr. Pupuma?
No, not really, but the same sentiments goes to you as what Dr. Jacobs has said. You've created a platform that is really helping everybody, you know, and we appreciate that.
All right. Goodbye, everyone, and goodbye to all our listeners. Sorry if you experience any technical challenges. We will fix them, and we'll come back better next time without any glitches. I appreciate all of you.
Bye. Thank you.